As you can see today, youth mental health is an international business, and it's the way of the future, and we're going to future-proof it, as you can see from the title. It gets bigger every time. It's mega, isn't it, Barbara? It's mega.
Like yourself, you told me earlier.
And so, yeah, it's a great day. It's a very great day. And just to underline the international nature of it, we're going to be hearing from a young man from Africa who sadly couldn't actually get here and make it in person, despite everyone's best efforts. But his name is Francis, or Oko. He's a Ghanaian youth ambassador, and he works with an organization called Curious Minds. It's a child and youth advocacy organization who work to meaningfully engage young people to participate in decision-making that affects their own lives, and develop young activists, because this is an activist business. There's no doubt about it. If we want to change things, we've got to become activists, and he's one. And he's linking up with us today across the equator. So over to you, Oko. Have we got the video? Yep.
Hello guys, my name is Francis Oko Armah, a youth advocate with Curious Minds Ghana and a Women to Deliver Young leader. I serve on other committees and work with other organizations in Ghana and around the world. I'm very passionate about women's health, children and youth development. I would definitely love to be with you guys in Dublin, but I cannot make it due to circumstances beyond my control. And so I'm sending you this voice message. I know you have fun. Trust me, I am with you guys. Now, I used to believe that it is impossible for young people to have mental health problems or issues. Do not get me wrong. As young people, we are happy, sociable, with lots of energy. And so I used to believe that mental health and its problems and issues are far from young people. We are very distant from it, until it happened to me. Now the question is, what really happened to me that changed my mind, my perception about youth mental health? I am not going to tell you. I know you want to know. I cannot share, because even as I still speak now, I do not know what my diagnosis was. Of course, I can share my experience. About 10 years ago, I lost touch with reality. I lost my identity and forgot about virtually who I was and everything around me. That was when the condition started. When it got worse, I just took off my pants and ran across the street and just behaved like any other person who has really lost it in the mind. And that was when my family realized that I really needed help. After a couple of sessions and medications at the Accra Psychiatric Hospital, I slowly recovered. Fast forward to now, 10 years later, I can tell you nothing has really changed. In fact, it is even difficult to experience, if you experience any mental health problem in this era than before. I perfectly remember that in between my sessions, I met a lot of other children and young people with different mental health problems. And then I could also see the frustrations that the psychiatric nurses and doctors were going through at the time. Each time they have to re-educate parents and the general public on how to handle children and youth mental health. Because clearly the lack of awareness and acceptance of the general public on how to handle these things was taking the bigger part of the problem than what the problem really is. Then there's a bigger health challenge of funding, medications, materials at the hospitals and health centers across the country, and a lot more challenges with the doctors and some of the things they were demanding. But that was the health system. Now let's move back into the community. In the community where tradition, culture, perception, gender barriers, among other customs and realities, fight against each other, especially when it comes to children and youth mental health, it's even much bigger of a problem. Why? Because when my condition started, the very people that I live with, the very people that I socialized, people that I know I could relate to, neglected me. Nobody would want to associate with you or even have a conversation because, quote unquote, you are abnormal. And that actually made the condition worse. The stigma alone could mean that you are not wanted by anybody. And in some communities around, people with such conditions are referred to camps where they are isolated from the rest of the world. And they are giving all sorts of medication. Sometimes these things are not proven. And so it actually makes the condition worse. Now, 10 years later, I am here, very passionate advocate, travel around, I speak, I work on committees on different health problems and all of that. But there is still a challenge. Recently in Ghana, it was very evident in the media that suicide cases had risen. And therefore, in this era where there is a lot of information, the internet is available, everybody is connected, you really wish that the public perception or reception towards receiving news of increased cases of suicide and depression of young people and other mental health disorders, the general public would really receive this and help the case or help try to solve the issue. It really was not the case. Anytime you hear a discussion on the media about young people's mental health, or a news break that a young person may have committed suicide because of this reason or that reason, the general public will ridicule you. You may be dead and gone, but the reception was bad. The judgments, the abusive comments, and all of that. As a young person, I could only relate because I have been there. Then there was this experience when, about 2-3 years ago, when we visited the Buster homes in Accra, and we had to speak to these young people about their states of mental health and what they're going through. I must say, the officers at the Buster homes were very helpful. The way they relate to these young people, irrespective of their mental health disorders, and how they really relate to them. Even though I was not admitted at the Buster home, I felt human because I had been in the shoes of the young people who were receiving care at the homes. That was a light that shined on the darkness of the story that people do not want to talk about. So traditionally, if it is detected in your background that there has been evidence of any mental health disorder or problem, it is also evident that you will be denied of marriage. So when people are looking for their partners and they find out that in your lineage there is a mental health problem, obviously, no matter how you be in love with a person, you will be denied of that union. That aside, children or young people who have mental health disorders, their attention is really low, as if the problem never really existed, until we start talking about it, until the media shines stories from the Buster homes, stories like myself, until I begin to share. People really do not know. So, what do we do about it? Well, as an advocate, my responsibility is to speak about it, because once we begin to speak, then people get to know about it. People are aware. People get to relate to their children or young people in a better way. There is a bigger challenge. For me, as an advocate who is always working and happy and smiling, working in the local communities, putting smiles on people's faces, when I am depressed, who do I talk to? When my emotions drop dead and I am alone in my room and I need someone to talk to, how do I even get that help? And so even for me at this level, it's even a bigger challenge, because the kind of work I do, you are supposed to put a face out there because you are the one who helps, but who attends to the other group of young people who also need help. let me share a bit of a personal story. I love hugs. Sometimes during this moment, I feel like I need a hug. I need someone to understand the phase that I am going through. I need someone to understand that I am not alone. I need someone who will just look at me without any judgment and know that there is care, there is enough love for young people experiencing different sort of mental disorders out there. But it's quite hard. One of the biggest challenges that a lot of young people in this part of the world continue to face is cost. Cost is one, judgment is one, and even the favorable environment, that space, that friendly space where you could just, speak out and not feel judged is a huge challenge. And so that is where the importance of support groups comes in. Support groups have been very helpful. It is a big challenge, but a few young people have identified a need to create such support groups, and I am very, very privileged to be part of a very close support group. It's a virtual group, so where we express some of our frustrations and problems. And in fact, despite the fact that I have this face out there and I need support and all of that, it was actually a bigger problem for me to accept my current reality. Because 10 years ago, I fully did not recover. Because for my father, who was taking me to sessions, once I had recovered and I knew my name and I was back to my reality and all of that, I really didn't need to go back for sessions at the psychiatric hospital. Of course, going for sessions at the psychiatric hospital only meant one thing, that it wasn't even a good place for me to go anyway. And so, since I've started recovering, I had to just stop. And a relapse of that has gotten me into a different set of condition all over, where the next minute I am happy, extremely happy and excited, and the next moment I am sad and I really do not want to exist anymore. I just want to die, like that. I just want to commit suicide and get off this earth because I just can't handle everything. So I am not alone, I know, but it's actually very hard coming out to talk about it. Because the next moment I'll be on radio and I'll be talking and I'll be smiling and talking about youth development and talking about constitution, strategies, policies and all of that. And then the next moment I'm in my room, in my own world, want to commit suicide. How does it even work out? But this is the reality of young people like myself and you out there who have different conditions and trying to struggle and find your feet in between. And the only way for us, like I said, is to keep talking about it and keep expressing. There is a whole lot I could talk about, but not everything within this short period. Clearly, I did a lot of research about my condition and what I had been through, because nobody would open up. The more questions you ask, the more silence you get. And so I begin to, learn about myself and read more about my condition. And I realized that clearly it was hereditary. My grandfather had a mental health problem. My grandmother from my father's side had it. My aunt from my father's side had it. And my mother also experienced it. But of course, this is a trait that families do not talk about. Moreover, we were children and we are young people. Who dares talk about mental health conditions with the young people in a family? Nobody does it. That is how it really is. Nobody. But I felt that if opportunities are created to discuss these things among families and all of that, it will rather start or serve as a learning point for us to learn about mental health. But clearly, it doesn't happen. If you will see families discussing youth mental health, it will be families that are really educated, like families that have a lot of education and understand the need to do it. But generally, it doesn't happen. for a lot of the reasons that I had already stated, it really will not happen. And so I had my own struggle understanding what I was going through. And even if I did, to educate my parents and the people around me was a different set of matter, because nobody is even willing to talk about it. So there is dead silence on the matter. And that is one of the reasons that actually keeps the problem, like makes things get worse, because nobody talks about it. Nobody's trying to find a solution. When it happens under the carpet. Nobody talks about it in the open. And that is one of the trends that need to change about youth mental health. We need to talk about it. We need everybody to come on board. But how do we do this? Now, I believe the family as a unit can really provide, can serve as a support system for youth mental health, for mental health broadly, and then in particular, youth mental health. The community, health institutions, there are challenges, but once it keeps coming, then we know that we will find a solution. And of course, government bodies, civil society, and everyone. But above all, it takes you and I to start something. And that is why I will mention the need for partnerships. We need more partnerships between ourselves as young people, because if you're not together to leverage on the very limited spaces, like the opportunity I have to speak, and like the opportunity that most of you young people in Dublin right now, some of you are doing poster presentations, some of you are doing have the opportunity to share. If we do not create that partnership to work on the very challenges that we face as young people, who will speak for us? Who do we want to speak for us if we cannot leverage on the youth voices that we have to speak on the very challenges that we are confronted with? I am doing my part, as I cannot do it all alone. We need each other. We need to lobby our government. We need to work on policies. We need to go to the grassroots level where people don't even identify these problems, to educate them, to leverage on the voice that we have to create change. I will be available on live discussion at the plenary, and so if you have any question, you can also forward to me. You can connect to me on Facebook, Facebook.com/Oko Armah, and then on Twitter, you can connect to me at the Oko Armah on Twitter. I am very much available, and I'm very open to opportunities of partnership for the development of young people in this, in the mental health space, so we could help for the benefit and development of all. Thank you.
Well, I think you can see why we wanted to bring him here, but he filled the room anyway. So I think it was very important because it shows that this is a big international problem. It's a global problem, and we've got to find a way to work across every country, because as the Lancet Commission report last year showed, youth mental health is the biggest issue for young people, absolutely, no question. And it has a massive economic impact too, and whether it's in Tala, as Lynn was talking about, or in Accra, we've got to bring everyone together, and we're trying to do that, as you can see. So the other thing I'd say about OCO is that in Australia we have this campaign called the Loud Shirt Campaign, and it's for the mental health of medical students and young doctors who are actually dying from suicide at the moment, and so I think he would win that campaign hands down.